since I've had the privilege of being with this organization, we've had a number of fantastic speakers. And the interesting thing to me is all of these persons are highly accomplished in either business or politics, and yet all of them seem to do a wonderful job of balancing their professional and political endeavors along with a family life. And Dan's the same. I asked Dan what is the most important thing to him, and I expected some type of Harvard Business School answer in terms of what his most proud accomplishment or achievement is, or what's the most important thing to him. He told me that the most important thing to him was balancing his business life with a strong family life. He is a very dedicated father. He's got 2 children, one at Duke, one a sophomore in high school. And I think a lot of our speakers, and Dan particularly this morning, are testaments to the fact that you can, in fact, do unbelievable things in business and still have a very strong, dedicated family life. And I appreciate that response. So without further ado, please welcome Dan Amos.
Y'all start early in Atlanta. It's a pleasure to be here. Let me start by saying that a group of this nature, the Georgia Public Policy Foundation, is something that I am proud to be a part of today, because it allows people of many concerns to discuss issues that are of key importance to all of us. You understand the role of government and how it plays not only on the state level but on a national level as well. The research and education that groups like yours conduct is invaluable in helping form opinions and allow people to reach conclusions that ultimately help them make proper decisions. A lot of politicians have talked to this group over the years, and I'm no politician, but I am heavily involved with the political activities because of our business. And certainly in the past year, perhaps nowhere has the role of government been so vigorously debated as with the issue of health care reform. It's sometimes hard to fathom that the tremendous change that we've experienced in public attitudes in just 1 year. Of course, many of those attitudes were reflected very clearly during the November elections. As an insurance company, AFLAC has watched the issues very closely and is prepared for many alternatives that could take effect in the healthcare industry today. We're still preparing for possible changes that could take effect. But personally, I feel that the real question that took effect in 1994's healthcare debate was, do Americans want government-run health insurance? As a debate over the question unfolded, it essentially became a national referendum. And the American public answered, in my opinion, with a resounding no. Yes, we still have problems with our health care system that need correcting. Yes, our country still has many uninsured Americans who need medical coverage. But the national health care debate revealed that most people agree that our system works. It just needs to work better. Most of us seem to agree that the system would not work better if the government was running it today. In 1994, health care reform was approached with a complete overhaul to the system. In 1995 and 1996, the health care problems will be addressed in more specific reforms, particularly in the insurance area. You could liken the 1994 reform issue to a shotgun blast, hit everything associated with health care, and hopefully have government involved in all those changes. I think in 1995, and you're going to see reform more like a rifle approach, specifically targeting insurance areas like pre-existing conditions and portability. I believe the broad-based approach to change that we saw in 1994 is dead in 1995 and in the foreseeable future. Instead, the 104th Congress will address just the most important elements of the system that need to be reformed. The end results may mean several things for the future of the healthcare industry. Very briefly, let me tell you that AFLAC has been very pro-reform. Since the beginning of the day, we have felt like that you have to address some of these issues. We're in a very unique position in that we are not a major medical carrier. We are a supplemental insurance company, which means that we offer our products to help fill the gaps that major medical and other existing policies have. Our policies are sort of like an airbag was a few years ago. People had their seat belts and they thought that was plenty, and when airbags came on they didn't know if they needed them or not, but now they've seen the need for them. And that's the way we think our coverage will be as the years move forward. More than 98% of our policyholders have existing major medical coverage and buy policies to supplement that coverage. All of our supplemental products are portable and guaranteed renewable, meaning they are portable in that you can take them with you when you change jobs and you will not lose the coverage. Guaranteed renewable means that you can never lose the supplemental coverage no matter how many claims you file. As our supplemental policies, we also pay fixed cash benefits directly to the policyholders regardless of any other insurance they have. The majority of our policies already have most of the very elements that health care reform is considering right now. However, through our experience as an employer and also our experience in the health care business, we believe that we're going to need to see more change. We are willing to do whatever necessary to help bring about the reform. Apparently, lots of insurance companies, doctors, HMOs, and employers and employees are willing to do whatever it will take to bring it about as well. We're already witnessing a variety of market-based corrections that are taking place. You may have seen the article that was in USA Today that said that health care expenditures actually went down. Let me repeat that. It went down by 1% in 1994 after a decade of runaway cost. There are plenty of good examples of businesses and good medical communities working together to hold down the cost and still providing quality health care. At AFLAC, as an employer, we have brought down our medical costs to all of our employees. We have done that in a consistent way of providing quality service to all of our employees. But in the last 4 years, we brought down our health care costs by 30%. We've done it by forming partnerships with area hospitals in Columbus, negotiating fees with physicians, and offering low-cost medical tests and screening to the employees. Let me just give you an example. All of our female employees over age 40 are allowed to have free mammogram tests every year. The first year we put this into effect, we had 4 females that we caught breast cancer in the early stages. Of course, the great news is it probably saved their life. But from a business perspective, it also helped control cost dramatically because we caught it in the early stages. If there are no lymph nodes being affected, the cost of breast cancer is $20,000. If it has metastasized and gone into the lymph nodes, the cost is $200,000. All 4 employees had said that had we not given the screening free, they probably would have never gone in to have had it. So early detection can truly help lower the cost of your health care. The health care debate initiated the successful beginning of what I believe was market-based reform. Despite the headway, though, there are issues that I believe our government will need to take up in the near future. Issues that I think we'll see addressed will be portability, ultimately because I believe the employees need to be able to take their insurance with them when they change jobs, and especially if they lose their jobs. This concept has some interesting ramifications for both the employer and the employee. I believe the employees will feel a freedom to make desired life changes. We know statistically that people are more reluctant about changing jobs because of health care than any other factor. And if you allow portability, you will resolve that problem. In turn, the employers will be in a position of hiring employees who already have health care. This may give them some appealing compensation options for employees who already have their own health insurance. Another issue I believe that will be addressed will be guaranteed availability. In the future, I think anyone will be able to purchase major medical policy if they desire to have it. In the current environment, some people with extensive medical histories have been unable to buy insurance. This is one of the major problems that we have in the insurance industry today. Of course, closely behind the issue of guaranteed insurability or availability is the pre-existing condition. All of us would prefer buying homeowners insurance if we knew the house was on fire. All of us would like to only own automobile insurance after we had had the wreck. You know, and I know, statistically that can't happen. The law of numbers is ultimately what covers the cost of insurance. And so the problem we have to address is how to offer products that span the entire group of people and at the same time offers a clear and proper value to the consumer. I think you'll see some type of pre-existing requirement. For example, a pre-existing condition clause might be 6 months. So if you have a chronic disease like, say, lupus, you'd still be able to purchase a major medical policy, but for the first 6 months, you wouldn't be covered under the treatments. But after the initial 6 months, you would be covered from then on. Other issues I think will be addressed will be community rating and tax deductibility. There's some dissatisfaction with the way companies set various group rates. Currently, some insurers set rates by loss experience of a particular group. So if you have a small group and everyone in the group is basically healthy for 5 years or so, then you have no problems. But if it's a small group and one person has a heart attack, then the cost associated with that heart attack can be so high that the cost then to that one group would escalate to where hardly anyone in the account could afford it. Community rating is one way to get around that. Community rating is setting rates on all groups in a particular community, say the state of Georgia. This system spreads the loss experience and would stabilize insurance premiums for all the groups in a particular area. The problem with it is that you can't focus as much on each individual group trying to control health care costs within that group itself. So there are pros and cons to almost all the issues that I bring to you today. In terms of tax deductibility, I think we'll see a variety of issues addressed. Medical savings account is one option under discussion today. These accounts would let the employers purchase major medical insurance with a large deductible, say $3,000. The employer or the employees would put their money into a medical savings account, and then they would pull the money out as they needed it. But the whole concept behind it is that individuals would try to control their own health care costs and not make as many visits to the hospital as necessary. And the incentive would be any money left over in the account could then be kept by the consumer. Hopefully that would result in the patients not making health care in terms of the system use it quite as much. Again, there are pros and cons to that as well, but that seems to be a system that is being considered right now. Also, in regard to tax deductions, we're hearing discussions right now about permanent tax deductibility of major medical costs for self-insured or anyone else who purchases their own insurance. Many believe that those who individually purchase health insurance should have the right to take a tax deduction equal to the amount of health insurance purchased through the employer. There also may be a possibility of tax credits if you buy certain type policies, such as long-term care policies. The government would get a break in that they won't have to provide as much care for these people that own these policies, and the consumer could get a break in that in the short term they wouldn't have the tax consequences involved. Portability, guaranteed availability, pre-existing conditions, community ratings, tax deductibility are just some of the elements that I think we'll see addressed in the coming months ahead. Looking at the bigger picture, we'll see changes in the healthcare system. Employers like AFLAC will be taking greater charge of their healthcare related expenses. Competition among insurers will definitely increase. A few companies survive by cherry picking the healthy individuals. They will have to change or will disappear. All insurers will have to run a very tight financial ship, keeping strong controls on cost. I think you're going to see a consolidation of insurance companies in the near future. Fortunately for AFLAC, there has been an even greater demand for supplemental policies like ours, and we feel that our future is great. Consumers will be more aware of their limitations on their health care policies and will seek supplemental products to fill the gaps that are created through medical and non-medical related expenses. And the insurers who want to win will have to provide the best value at the best price for the consumer. We've seen companies wreak havoc in the marketplace by being low-cost producers. We've seen it with Walmart, we've seen it with Home Depot, we've seen it with other companies. It amazes me that a lot of insurance executives do not think it's coming to the insurance industry. I personally believe that it is. It will be the low-cost producer that ultimately will survive in the decade ahead. In my opinion, health insurance is no different from any other area, and that's what will be the key to our future growth. At AFLAC, we're working on technology, internal efficiencies, and controlling costs to lower expense ratio. We are taking that money and not increasing our profit margin, but rather returning it to the policyholder, because we believe that is the best way to grow our business. This will allow us a more competitive edge by paying more claims to the policyholders. If you look back at every product that we've introduced in the last 8 years, every product we've introduced has had a higher loss ratio or a better buy to the consumer. I think that is what is important. At AFLAC, we believe that you have to constantly stay on top of things, and we are the leader in the supplemental health insurance business. To do that, you've got to constantly beat your competition, both present and future competition. And ultimately, that's what makes the great American free enterprise system work. Not government, but rather competition. Who will be the big winner in health care in the future? I think the answer is easy. Though we may not be moving as quickly as many of you would like, we are headed toward an environment where health insurance will be more accessible, better priced, and more fairly administered than ever in our history. I think change will come about in large part by market corrections, with the government's attention restricted to specific areas. And the big winner, well, it should be you, the consumer. So with that, I'll take some questions about health care. I don't claim to be the expert, but we have had a lot of experience in this area and be glad to take some. Yes?
I'm ecstatic with your talk. I thought it had great balance in discussing all of the issues that are on the table, really, especially the talk that you had about the tax incentives, which I think cause much of our problem. And I'm also pleased that Griff Glover is having this conference on the tax incentives on April 5th, and I encourage everybody to go. When you talked about the rifle shot about portability and the pre-existing, and you solve that by insurance reform, my own opinion is that both of those things could be more appropriately solved by tax reform. And by that I mean that you would allow the individual the same tax break for his insurance policy as the employers get. And if the individuals bought their own, then of course they wouldn't have a portability problem because they own their own problems. And if they bought their own, they also would buy policies that had pre-existing clauses, or at least that if they got a disease, they wouldn't lose their insurance once they did it. So I guess my question is, do you think it'd be more appropriate to put that rifle shot towards tax reform rather than insurance reform? Thank you.
I think the answer is that certainly tax reform is one way of doing it. The one question that I have to look at is, how do I think the politicians will do it? And I'm no politician, but they brought health reform to the forefront, and I think they're going to feel a sense that they've got to address it in Washington. Personally, a tax incentive would be my favorite way of looking at it. But from an American public standpoint, I think you're going to see it addressed the other way instead. No one knows for sure again, but I certainly couldn't argue with your point of view and would be for it. Yes?
Yeah, my question has a premise, and that is that given enough time and dollars and an environment that's conducive to research and development and that sort of thing, that this society can produce a lot of fixes, both in terms of drugs and medical devices, which can serve to remove, reduce, or eliminate most of the maladies that we face today, the conditions. And if that's true, what is the insurance industry, if anything, doing to help lead the charge in reducing the regulatory morass that small entrepreneur companies face today, and trying to develop and bring to market new drugs, or the larger drug companies too, to the market?
In 1994, I think all insurance companies were just trying to tread water more than try to find any other situation to attend to, because it was such dramatic change being proposed that there were some proposals on the table that would totally do away with insurance companies. And those issues, all of a sudden take the first or the forefront of all of us. Now issues concerning red tape and specifically issues about small business are concerns of ours. We try to do that on an individual basis in terms of supporting candidates that we feel will help make less government instead of more government. We have a political action committee that's very involved. I'm always amazed with people that say, well, political action committees are bad, or you're trying to buy a politician. That's the furthest from the truth. Only thing it does is gets an ear, and they will listen to you. And then if they listen and they like it, they'll help you, and if they don't, they'll go on. And some to help, and some don't. But that is ultimately what America's all about. And what we try to do is to get our points across. We specifically can lower, the more things we can do to lower our expenses through less regulation, the better buy we can give back to the consumer. And that's ultimately what we want to do. You know, I always give this speech to our employees, is that there's a pie and it's only so big. And as a stock company, our first responsibility is to take part of the pie out for the shareholders. And then after that, you can split it any way you want. So much will go toward return to the consumer, so much will go toward expenses. Those are the three elements. And the more we can close those expenses, the better buy we can give to the consumer, because I'm satisfied with the profit margin. So ultimately, when we can close down regulation and red tape, we can give better buys. So we're for that. Yes?
If you have widely divergent loss ratios across the industry for similar lines of insurance, what sort of policy instruments would you like to use or see used to have some convergence of loss ratios so that you don't get that cherry picking effect? What sort of tools are available to oop the system in that direction?
Well, the thing that I have seen is that competition ultimately provides the best avenue for setting out which products are the best value. They will pull the people in because the consumers are much more intelligent today than they were a few years ago. They understand more about value and about service and quality, and we ultimately see the competition as being the thing that will prevail. Now, there are mandated loss ratios in certain states. We can live with those mandated loss ratios, but I'm much more frightened about an aggressive competitor than I am a mandated loss ratio, because an aggressive competitor will do anything. And a mandated loss ratio within reason, I mean, there are groups out here. It always amazes me that there's two areas that people want to discuss. They want to discuss loss ratio, and they want to discuss financial security. And what they want is you to pay 110% loss ratio and be very secure. And they don't balance. And to meet with some of the groups out there, it never does click with them. And so we think that the way to do it is through free enterprise and through competitive nature. That's what we've tried to do. That's why we don't have this strong mandate of keep upping our loss ratio from a regulatory environment. We believe we should do it from a competitive environment because it's the right thing to do. And we don't want to see our cost go in a fixed mode method of just away for nothing. We'd rather see it go back to the consumer. Yes?
And you have mentioned the importance of controlling your expenses. You also mentioned foreseeing a consolidation of the insurance industry over time, and you mentioned the idea of the road competitor out there. How much of consolidation do you foresee coming about in the insurance industry? Do you think insurance is likely to follow the path that banks and other financial institutions have played, with some institutions so competitive trying to stay alive that they make things difficult for everyone else?
Well, I spoke at a Merrill Lynch conference 2 weeks ago in New York, and there were 5 CEOs of insurance companies. And I was amazed that of the 5 CEOs, 4 of them, we were the only one that was going to grow through acquisitions, not through internal growth. So their whole strategy was to do it that way. So I think it's possible that you'll have a half to a third of the insurance companies you have today by the year 2000. You know, remember in Japan, which is our largest market that we do business in, there are less than 40 insurance companies. And we've got over 3,000 in the United States. So it's a totally different way of doing business. Does that answer your question, John? Okay. Yes.
Do you see more or less state regulation?
Well, you've got politicians that can answer that question better than I can in the room. I would hope you would see less regulations. I would hope that what you would see is parameters under which we operate. And then after, or whatever those parameters are, solvency requirements, whatever they might be, then other than that, it becomes butting heads on a competitive basis. Pete?
You just mentioned Japan. We've heard a lot about what's going on over there. The earthquake and turmoil over there. Share with what's going on.
Yes. I was in Japan the first 2 weeks of January, and I was in Kobe 3 days before the quake hit. We have 54 offices throughout Japan, 2 of them in Kobe. Kobe accounts for about 3% of our production. We've got about $5 million in revenues coming out of Japan right now. We insure about 22% of the Japanese population. It is unbelievable the devastation that has taken place over there. And we as a company wanted to do something to say to Japanese business and individuals that we're concerned. You know, we spend so much time arguing and having discussions over the trade issues, but at a time of need, I think it's very important that everything stop and call a timeout and help people. And we as a company wanted to do that. Make no doubt about it, the Japanese people, the businesses, and the government has been good to AFLAC. And so we formed a partnership with the American Red Cross and formed a Helping Hands Fund and gave $1 million initially, and then another $1 million as a matching fund. And I spearheaded raising money for the Kobe relief victims. And we raised, as of last Monday, we raised in excess of $5 million. Now, you have to put that in perspective. They probably had devastation somewhere in the $100 billion area. So it is minuscule, but symbolically it's so important, in my opinion, because it shows that Americans and American corporations are interested. I had companies in Georgia give, and to many of you who are probably in the room that I contacted your companies, please thank them for their gifts. I can't name all of them, but a lot of you participated, and I truly appreciate that. And the Japanese people truly appreciate it. I have to tell you one story about it. To me, everybody, or most of you, know the story of the widow's mite in the Bible, and this is my favorite story, is that we have a school called St. Mary's Elementary School, 75% minorities, that called us last week and said, we didn't say anything, but we've been raising money by getting pennies, and we have raised $900. Well, we gave $2 million, and I'm telling you, the $900 was bigger. And we're matching the $900, and we have arranged for the Consulate General to come down and accept the money next Monday because of it. Now, we had other schools give, and they're important, and we appreciate what all the other schools did. But this little school is something really special, and it shows and symbolizes how when the world has a calamity, that we can all join together and help each other. Yes?
Your perspective as a company that's writing policies, obviously, throughout the country, outside of the federal tax changes that you mentioned, all the insurance reform front, do you think the solutions are best addressed in Georgia at the state level, particularly where insurance regulations occur, or since a company like yours does business everywhere, would be more advantageous to you or the industry to have the federal Congress address this?
Well, being a Georgian, I'd generally rather have Georgians do it. I mean, so I think states can handle it in a much more efficient manner. McCann-Ferguson set it up where it would be done that way. It would require a repeal of it otherwise. And I think that the states can act on specifics. Now, there are some disadvantages to the states handling, one being administrative cost. I mean, we have to make brochures for almost every state, has to be a little different. So it changes. But all in all, I think that no one knows more about their constituents than the states know about their own. And so I would say the state level. Yes?
It's been estimated that at least 50% of all healthcare costs can be attributable to controllable health factors like smoking, drinking, overweight. What are you doing for your possible to encourage and motivate them to develop healthy lifestyles? Like you mentioned with your breast exercise.
We have a wellness benefit that we've added to almost all of our policies, whereby in one particular one, if you go have any type of screening, procedures, anything done, we will return X amount of money to you for having those particular measures done, a physical, whatever it might be, but it's a flat amount of money we send to you. So it encourages them to go out and to have these things. We're also constantly in our literature encouraging people to do that and putting out important information that deals with diet, exercise, all the issues that you would think about. Certainly smoking is one of the issues. We just have added a new board member that is being proposed, and her name's Barbara Rimmer, and Barbara is chairman and appointed by the president, and is chairman of the National Advisory Board for Cancer. And she's going to be working with us on making people more aware of cancer as well as heart and other areas. So it will be of concern to us. Last question?
Last question. Seems that the ultimate cost containment should be based on the fact that the person participates in their own expenses. If the person doesn't care how much the doctor spends or the hospital spends, the costs will go up. It's provided free. It seems to me that this is the ultimate thing that we should seek to achieve, is have the person personally care how much is spent. So he will shop around and hopefully have the opportunity to. And I just think your idea of your medical insurance plan has at least that element in it, which makes it very attractive. I speak as a physician. I think if the person doesn't care how many MRIs the doctor does, that runs the cost down. And I just commend that as an integral part of your. I don't know whether you have a medical savings account program or if you advocate this. What is your position on that type of coverage?
Boy, doctors will pin you down, won't they? I think it's a good thing, and I think controlling health care cost is ultimately the way to go about it. And people, that's some of the things we did in our health care plan internally, is we required each of our employees to pay a little bit of their own money to do something, and it was amazing how it went down. So I think it is important. There are advantages and disadvantages. That the obvious, I have to try to balance it, I have to say the disadvantage of the medical savings plan is that it is X amount of deductibility, $3,000, whatever the amount is, $2,000, whatever you come up with. The downside to that is that if it's an American that doesn't have a lot of money, they may not have $2,000 or $3,000 a year. And your healthier people will go into that plan naturally. And the thing you have to be careful of is to make sure there is an anti-selection. We as insurance companies can cover any risk as long as we know all the elements of the risk and we don't have people try to select and pull out different areas. And what I think is going to happen is that we will become much more competitive, we will see a much more broader based, and we in essence will cover a lot more people by spreading the risk among everyone, and certainly the medical savings plan is an excellent way to do that. Let me thank you again for having me. It's a great honor to be here. You've had such distinguished speakers. I'm in awe of the group, but I wish you all the best and Godspeed to every one of you. Thank you very much.